again, we have an excellent session on the idea of the new social history. We already ask hard questions in social histories. Why not ask if people are registered to vote? So you know Alister very well. One thing you may not know about him is that in addition to being an incredible ER doctor and the founder of Vot-ER, he also has a lot of expertise in behavioral insights, and he's been thinking a lot about how to apply that to our work at Vot-ER. And then Maya Alper is just an incredible, incredible leader at Ideas 42, and she has been our guide all along the way and really deeply understands the research behind this. So without further ado, I am going to kick it over to Alister and Maya to kick us off.
All right, this is very exciting. And in a recent Zoom meeting, I heard someone say that the more we use Zoom, the worse we get at it. So we will see how this goes. Awesome. The age-old question, can everyone see my screen? Get a thumbs up.
Yep.
Awesome, thank you. All right, so here we go. As Leah said, my name is Maya Alper, and I'm a senior associate at Ideas 42, and I'll just jump right in. So to give you a little bit of background about our organization to start, Ideas 42 is a nonprofit behavioral design firm. So in our work, we use insights from the behavioral sciences, so that's economics, psychology, cognitive science, and other disciplines, to design solutions to persistent social problems. We work across focus areas both domestically and internationally, including sustainability, economic justice, financial inclusion, and of course, health and civic engagement, which are the topics that bring us here today. Voting and civic engagement work is organized under the Voter Innovation Lab, where we work on a number of initiatives that use behavioral science to help bring forth a vibrant and multiracial democracy that can better serve everyone. But what does that really mean? Specifically, we reach voters through three main channels. We work with election officials at both the state and local level to provide direct support on their policies and program implementation and help them communicate more effectively directly with voters. We also work with a number of different voting nonprofits to help them optimize their services and embed some behavioral design support into their functions. And lastly, we work directly with voters to spread evidence-based messaging and tactics and meet voters where they are. And so because we're focused on behavior change, to give you a little bit of a peek behind the curtain, this is how we look at the electoral landscape from the voter's perspective. And we hope to innovate at every point along the voter journey. Specifically, we're looking at both people's ability and their intention to vote. So we ask, is voting easy enough? Do the laws or policies support equitable access? Do people have the available resources they need? And do people want to vote? Does it feel personally meaningful? Does it matter to them socially? We believe that both of these conditions have to be true for voters to cast a ballot. And so that's why we spend so much time unpacking and addressing the underlying behavioral barriers that can stop someone from saying yes to either of these two questions. And so now that you have a little bit of a window into how we think about the work at Ideas 42, I want to focus specifically on voter registration and the trends that we see both in the research and in practice. And of course, what that means for you all as people that care about this issue. We're going to focus on voter registration since it's one of the early hurdles people have to cross in the journey to casting a successful ballot. But a lot of the insights we'll talk about can apply to folks wherever they are in their voter journey. So first, we have to answer the question, where are most folks registering to vote? In looking at data from the 2018 Election Administration and Voting Survey conducted by the EAC, we can learn exactly where most Americans are registering to vote. We can see that 16% register to vote online, 9% in person, 11% by mail, email, or fax, 15% through other means like registration drives or at military recruitment sites. But what's this big piece here that accounts for almost half of voter registrations? You might be surprised to learn it's actually the Department of Motor Vehicles. 45% of voter registrations in the lead up to the 2018 election occurred at the DMV. So what does that mean when almost half of voter registration interactions occur at the DMV, which is an organization that serves many Americans, but not necessarily all parts of the population equally? Who ultimately ends up registered to vote? Looking at data from the US Census Bureau, we can see that although more than 2/3 of the citizen voting age population are registered to vote, those who are on the rolls are whiter, older, richer, and more highly educated than our country as a whole. And this leads to distorted trends in voter turnout, in representation, in the policy preferences that are represented in the legislation that's introduced and ultimately passed. And all of this is quite troubling in a country built on the lofty ideas of being for the people and by the people. Alister mentioned the statistic yesterday, but to unpack this a little bit further, among people not registered to vote, a handful here and there throughout their lives have been asked to register to vote by these institutions, whether at school, by a religious group, by a friend or family. But we also see that 62% have never been asked to register to vote before. So what does that mean for you all as clinicians? If 2/3 of the unregistered population have never been asked to register to vote, we in the civic space have a huge gap that we can chip away at. And of course, we're doing that through multiple tactics. On the policy angle, we're constantly working on reforms that reduce the burden, like automatic voter registration or same-day registration, both of which can remove some of the hassles to getting registered. And as Hannah from the Brennan Center mentioned yesterday, there's constant legal battles to help ensure that folks can exercise their right. But in the meantime, you all have a huge role to play in inviting your patients and clients into the electorate and being one of those people that actively asks them to register to vote. But why is it particularly important that you all as healthcare providers get involved in this quest to broaden the electorate? Traditional economic models of behavior tell us that people will make a decision to act if the benefits outweigh the costs. It's a predictable, linear, and rather simple model about how folks make decisions. So in the traditional model, all it takes to get someone registered to vote is for them to perceive the benefits to outweigh the costs. And therefore, their action will naturally follow from this decision. But as most of us know, being people, being around people, human behavior is anything but simple or linear. When it comes to making a decision, we can decide yes, we can decide no, but we often fail to make a decision at all. And then the path from decision to action and ultimate outcome is anything but linear. We can be thrown off course or be put through twists and turns by subtle features of the decision-making context. How difficult is this task? Am I in the mood to do it? Was I already good today? Is it going to take long? What are other folks doing? Can I do this tomorrow? This more complex view of human behavior suggests that there's an opportunity for us to support people in bridging their intention to do something and their eventual action. And one way to do this is by designing the context in which they're making decisions. We see in study after study that self-reported voter turnout, so the number of people that have reported that they vote to pollsters or researchers, is almost always higher than actual voter turnout. And that's because folks are lying and saying that they voted when they didn't. And this reveals something important about folks' intention to participate, and that perhaps something got in the way of their ability to. Taken together, all of this means that we can't take for granted that someone is going to end up registered to vote simply if they believe the benefits outweigh the costs, or even if they have a strong intention to do so. Instead, we have to be more active in creating supports along the way that make it easier for them to follow through. At Ideas 42, we often call this bridging the intention-action gap. So what are some strategies to bridge the intention-action gap? Of course, this is always going to depend on the individual decision-making context, but one simple thing we can keep in mind is repetition. Repetition forces us to not take for granted the notion that someone will always act on the first opportunity they're given to do so. Evidence from the broader behavioral science literature suggests that the conversation that you have with your patient or client about voting can have a huge impact on whether they ultimately end up registered, even if they don't register to vote with you in that moment. Because we know it often takes more than one ask to motivate action. And there's a number of principles that can help reinforce this idea. The first is that familiarity breeds comfort. In the B-side jargon, we often call this the mere exposure effect. And all that means is that the more exposure we have to something, the more we tend to like it. things grow on us and we acquire taste for things over time and repeated exposure. So the research for this has mainly focused on our preferences. So for things like art, people, and words, but it can also apply here in the context of registering to vote. The more that we're introduced to this concept or become familiar with it, the more comfortable we'll be with it and the stronger our intention to take action. We also find relevant findings in the reminder literature, which is compelling across a number of different contexts. And that's reminding folks multiple times through multiple channels increases their likelihood that they'll eventually take action. While we often consider reminders in the context of a single program or a single messenger, so say your hospital's reminders to their patients over the phone, over email, and over text message of an upcoming appointment, it's also true that receiving reminders from different messengers over a longer time horizon can also motivate eventual action. So stated again, even if you don't register your patients or clients directly as they sit in your office, your ask can contribute to their broader civic engagement journey. So if you're not convinced quite yet, let's look at a couple different studies of how this plays out in the voting literature. So the first is from the Filer Voter Program, which occurs at VITA tax prep locations that help millions of low and moderate income households file their taxes every year. In this experiment, a voter registration ask was included in the standard tax prep process, and voter registration rates in the treatment group increased by almost 5 percentage points. We also see this in the classroom context. In this experiment, students sat through a 15-minute presentation that encouraged them to register to vote, and they were also handed out a voter registration form to fill out in that moment. This experiment led to an increase in registration rates of almost 6 percentage points. And what the authors note in this study is that although the students were definitely free not to register to vote, a unique feature of the classroom context was that the audience was captive and forced to focus briefly on voter registration. And they suggest that perhaps the students least attentive to voter registration are those who are likely to need a little bit of assistance in registering. So less aggressive tactics like tabling at the dining hall or student union aren't likely to be quite as successful as this moment of forced choice in the classroom. Lastly, we also see this in door-to-door canvassing. This experiment was conducted across 6 different cities where households were randomly assigned to receive a visit from a face-to-face canvasser or not. Households in the treatment group, their registration rates increased by 4.4 percentage points, suggesting that registration is a burden for a portion of the eligible population. So what's the bottom line across all of this evidence in a number of different contexts? Ultimately, it's that you should be asking every patient to register to vote, to create that moment of choice for folks. But it's not just necessarily about creating any moment of choice at any point in time. You all can be a particularly powerful messenger in the way that you can grab your patient's attention, especially in a context where they may not necessarily be expecting to be prompted to register to vote. But it's not just that you're anyone. You're a messenger that's particularly well suited to this task. Researchers from Columbia University School of Business have done a lot of in-depth work into the types of messengers and their specific traits that are particularly powerful in motivating action. What their research shows is that there's 2 main valuable sets of traits that determine what makes a good messenger. The first are messengers who have a sense of status in the eyes of their audience. And the second are messengers who have a degree of connectedness with their audience. Now, luckily, as healthcare professionals, you all have the status of being perceived as an expert by your patients. And in addition, based on the rapport that you build, you are perceived as both warm and trustworthy in the eyes of your patients, making the message that you share particularly likely to have an impact. So what does this mean for you? Alister is going to walk through some specifics about how exactly to incorporate this voting ask into your busy routines as you see patients and clients, but I'm going to leave you with these 2 main things to keep in mind. The first is that wherever possible, you should be creating an active moment of choice for your patients and clients by asking them directly if they're registered to vote at their current address or if they're ready to vote in the upcoming election. Second, you should be asking them directly if they're registered to vote at their current address or if they're ready to vote in the upcoming election. You should be following up that ask by making it as easy as possible for them to take action in that moment. This helps folks avoid those twists and turns, like forgetting or getting derailed by limited attention. One way that you can help make it easy, in a shameless plug for Vot-ER, is to use your Healthy Democracy Kit, which will walk folks through the process right there in your office. So if I leave you with nothing else at the end of this session, is that you should be learning to incorporate how to ask every patient or client to register to vote in your new routine. So I will pause there. I think maybe we'll do questions at the end after Alister has presented, but here is my email address. You can definitely feel free to reach out to me if you have any questions.
Thank you so much, Maya. And just a quick shout out to Ideas 42. You know, this work that we're able to do here at Vot-ER would not be possible without Ideas 42. They've really been the sort of foundation of what we've been doing from day one, and have been sort of helping to really craft from top to bottom behaviorally informed interventions that make it easy for folks to engage. And so thank you very much, Maya, and thank you to the whole Ideas 42 team. So I'm going to spend some time getting into the weeds a little bit about how you can update the way that you talk about voting and civic engagement, and the way that you bring this up with your patients. So first, I want to start with your unfair advantage as healthcare providers, okay? If you were an accountant, I would say, you know what, this is going to be challenging for you, talking about an awkward, topic like voting. If you were a social media strategist, I'd say, you know what, yeah, maybe you ought to, sort of think about how to do this in a way that's more comfortable for you. But the bottom line is, as healthcare providers, you already do this. As social workers, you already do this. And I want to talk about the hard thing and why you are already good at it. It's our job to ask awkward questions, quite frankly, that have an impact on our patients' health. In fact, us being good clinicians, nurses, physicians, social workers relies on our ability to hold the space and really inquire about important subjects. Some examples, questions I ask every time I go to the ER, and maybe these are questions that you ask, or they will spark questions that you ask when you're taking care of your patients. When was the last time you used heroin, cocaine, meth? Are you thinking of hurting yourself or others? Or, like we all learned in medical school, to not prejudge people's sexual history and sexual behavior, men, women, or both. These are not questions that we typically ask each other in a day-to-day encounter, but as healthcare providers, we get comfortable holding the space and really getting into this work. Why? Because it matters. And I'm here to tell you that asking about voter registration is incredibly important because it matters. The connection between civic and physical health is incredibly tight, and we've got to start bringing these conversations in to our clinical encounters as well. And so, to summarize, you have an unfair advantage already. You're already good at this. You're starting on second base. And so really, my job here is to kind of refine and give you some practical sort of scripts to use when it comes time to talk to your patients, your clients about this. So the overview of what we're going to do today is the following: the why, the when, the how, and then we're going to give you some tips. We're going to start with why it's important to ask your patient. We keep drilling this because repetition is an incredibly important way that we're going to get this learning done. Number two, when. We'll clarify some opportunities to intervene and ways to think about when you can bring this up. The how. So you've initiated the conversation. How do you transition to action? If we were salespeople, it would be, how do you close the deal? You've given the preamble, but now how do you actually close it? Make sure that that ends up going into the action that you want to happen. Then tips will give you some takeaways. But first, the why. We're going to start it again because I want you, when you go back in the spaces and places that you exist in as a provider, as a social worker, to be able to rattle this off, right? We have 51 million people in this country who are not registered to vote, which means something incredibly important for you as healthcare providers, right? It means that our public is not the same as our electorate. There are two different things happening here. There's the public, which is poorer, more diverse, more in need than the folks who are voting. And so the laws that come out of that don't serve the people who make up the public. So we have 51 million people in this country who are not part of the democratic process. And when you ask those folks, just like Maya shared with you, majority of those people have never even been asked, okay? Why does this all matter? Well, it matters because if folks don't vote, campaigns label them as unlikely voters, and then they don't make contact. And because they don't make contact, their policy preferences, their perspectives, their needs, wants, and desires are not in the platform of that governor, that mayor, that state representative who is now creating policies in that district. And so what does this mean, sort of practically speaking? Because that's a theory, but let's get down to brass tacks. What it means is this: when you look at places that have low voter turnout, those same places are places that have lower life expectancy rates. When you look at places that have low voter turnout, those are the same places that have higher impacts of really awful healthcare policy decisions, higher rates of diabetes, higher rates of heart failure, liver disease, chronic kidney disease. Let's look at East Harlem. For those of you in New York, this particular precinct in East Harlem had a 35% lower voter turnout rate in 2018. That same area had a 20-year life expectancy drop. That same precinct. Let's go to Detroit for folks who are in the Midwest. This is Southwest Detroit, small part of Detroit, 24 industrial sites. Okay, they've got oil storage plants, salt piles, asphalt plants, chemical plants. Residents there live 7 years less than the US as a whole, and they present to the emergency department at much higher rates for asthma and for heart disease and myocardial infarction. Okay, so Southwest Detroit has a really awful environmental stew that's happening there that's killing the people who live there. Quick poll. Do you think Southwest Detroit has higher voting rates or lower voting rates than the rest of Detroit and the rest of Michigan? If you think it's higher, you give me a thumbs up. If you think it's lower, give me a thumbs down. What do you guys think? Okay. I'm seeing a lot of thumbs down here. Yeah, exactly. Of the 100 lowest precincts in terms of voter turnout, 41 of those are in Michigan, first of all, or are in Detroit, first of all. Of that 41, 19 of those precincts are in Southwest Detroit, meaning there's a focus of really low participation in this area, and it's killing the people who live there. So don't tell me that civic health and physical health are not related. So that's the why. Why is it important to help people vote? Well, because they get labeled as likely voters, campaigns make contact, and their policy preferences and perspectives are taken into account. And this is where you come in, healthcare providers and social workers promoting voting. So that's the why. Some folks ask, well, no. Patients don't want to hear about this. They come to me for, their elbow pain, or they come to me because they need their Foley replaced. They don't want to hear about voting. Well, we've got data that proves otherwise. This is a voter registration project that was done in New York that found that 89% of eligible and unregistered voters were actually interested in being asked about voter registration when they did this project. Okay. All right. So we've covered the why. Let's say that I've sold you on the why and sort of the background of why this is important. Now we've got to get into the when. When do you bring this up? So this is a pretty typical flow that a physician, a medical student, resident would use. Social workers, I'm sure you have your own approach to this. Perhaps the biopsychosocial at the end of this, you can sort of think about that as the intervention point for you all. But for for physicians and for residents, the social history offers the first and most important opportunity to talk about voting, okay? There are two ways to do this. Number one, you can embed this into your traditional social history. What does that look like? It looks like the following. Do you smoke? Do you drink? Are you safe at home? Are you registered to vote? Simple as that. Okay, so embedding it into your traditional history, social history, is a way to make sure that you ask all patients. Another way is to, once you're done with the social history, set up what we call a bridging line. Okay, we're all done with this part of our history, and I now want to transition us to something else that's really important to your health and well-being, and that's voting. Are you registered to vote? Here is where I'm at. This is what I do, because, and we're going to get to why in a second, but for me, it's at this point standard practice, and it's almost like this is what I rattle off now when I talk about my social history. But I started here. What you will hear, I promise you this, you will hear 90% of your patients say something to the extent of this. Are you registered to vote? They'll say, yeah, I think so, or yes, yeah, like sort of what we call a counterfeit yes. A counterfeit yes. They're not necessarily too super interested in telling you that they're not registered to vote, because there's a certain shame around not being civically engaged or active. And what I'm here to tell you is that you've got to push through that. Are you sure? Okay. You'll then hear something like this. I'm pretty sure, right? I'm walking you through the entire way this conversation is going to go. Okay. Pretty sure. Okay, great. Now let's transition to the how. So you've initiated the conversation, and now it's time to close and get the action that you need. The transition is important. So you've asked them, again, let's go back. Are you registered to vote? And say, yes, I think so. Are you sure? Pretty sure. Okay. Do you want to take 30 seconds to double check while you're here today? I see you already have your phone with you. All you have to do is scan this QR code or send this text message. And that's when you use your Vot-ER Healthy Democracy Kit right there. Now, a couple things. If you have time, this is, a style thing that I like to do if I have time. If it's not busy in the ED, I'll actually wait and walk them through the process. And I'll say, okay, great. Click that button. Okay, fantastic. Right there. Fantastic. Great. And I'll walk through it with them. It takes about 60 seconds for them to get through the entire thing if someone else is watching them. If not, what I typically do if I don't have time, I'll say, okay, great. Why don't you go ahead and do this, open that screen up, and then after we're done, go ahead and check back in and finish the process. So you've started them on the process, right? There's a lot of data that demonstrates that when you start somebody on the process, when you get them 20% or 30% perceived of the way there, they'll want to complete it, right? And so what we're doing here is making it a little easier because they've already engaged in that first step. And so that's the social history opportunity. Another opportunity to bring up civic health is in the wrap up. So at the end of your conversation, at the end of your HPI, at the end of, had the whole conversation with your patient, now it's time to sort of wrap things up. There are two ways you can do it here. Number one, you can embed it into your traditional wrap up. You're just about to, stand up and walk out of the room, or you're just about to grab for the doorknob and move on. But you say, we're all done for today. I now want to transition to something else that's really important to your health, and that's voting. Are you registered to vote? And you follow the same exact protocol, right? Are you sure? Yes. Okay, great. Do you want to double check? You can also apply COVID framing to this, which I think still works. And if you've never done this before, that might be the easiest place to start. We're all done today. Before I let you go, I want to acknowledge that with all the disruptions related to COVID, it can be hard to do things like remembering to register to vote. Are you registered to vote? And so using COVID as an opportunity to sort of move the conversation to this voting and civic engagement lens is also another way to do this. All right, so we've set you up for the second when, the wrap up. But now how do you close the wrap up, right? We've got to close and make sure we drive to action. As Maya said, close that action intention gap. So this is one way to close that conversation. And this is what I use. If I haven't done it in my social history and I want to get to this topic, but I don't have a ton of time, I got to run. I have to go see another patient. Well, why don't you take 30 seconds right now to double check your voter registration while you're here? You already have your phone, just use your QR code, use this QR code or this text message, and you can get started. And if you have any questions, the platform will walk you through the rest. All right, so that's how to do it at the end of the conversation you have with your patient. Now, this is really important. When I say the platform will take care of the rest, the platform will take care of the rest. I don't want to be an expert in voting, and I'm pretty sure you don't want to be an expert in voting. And we don't have to be experts in voting to help our patients with regard to voter registration. Our platform offers both a text helpline that's 24/7. God bless these people who man and woman these text hotlines 24/7, comes in real handy in the ER. Or they can call, and it's in English and Spanish. This is what it looks like. When they click this button, it goes to something like this, and they type in their question. And here's an example. I typed in, what ID do I need in the state of Massachusetts? Did this morning at 11:37 this morning. And I asked this question, what ID do I need? And the other thing that's really cool, I didn't even say that I was in Massachusetts, which is really interesting. And they got back to me with, here is what you need in the state of Massachusetts. You can also call them. The patients can also call them 24/7 and have a conversation in English or Spanish about whatever issue they have. All right, so we've done the why. We've done the when, social history at the wrap up. We've given you two hows, right? To close them, making it very simple to sort of connect that action tension gap. Now we're going to give you some tips to close it out, okay? Tip number 1. It will take you exactly 7 tries before you truly get comfortable with this, all right? It's not going to be comfortable the first time. And for the physicians and the nurses on the line, even the social workers, remember the first time you did a central line. Remember the first time you put an IV in someone's antecubital fossa. Remember the first time you did a biopsychosocial. It was awkward. You did 7 of them. You got good at it. It became second nature. Same thing here, okay? So here's the action. Decide which of these scripts you're going to use. Are you going to, say, with all that's going on with COVID, I just want to make sure that you're doing all the things that are really important, like remembering to register to vote, and practice on your loved one, on your son, on your husband, on your sister. Just practice it, because the more you do it, the better you get at it, right? Tip number 2, plant the seed. You don't have to boil the ocean. I'm mixing metaphors there purposefully. You do not have to take someone all the way through the voter registration process. That's not the standard that I want you to be thinking about. Some of these patients will go all the way through. I'll have about 3 or 4 conversations about voter registration per day, and maybe only one of them will actually walk through the process on their own. But guess what? As Maya said, just having people be exposed to this is going to do an incredible amount to get them over the hump. So the action here is try this with 1 non-urgent patient that you have during your next shift, if you're a social worker or if you're an ED or if you're a healthcare provider. All right, number 3, again, you don't have to be an expert on voting. That's what the platform is for. Turf to the platform. For my residents out there, you know how to turf real well. You turf to medicine all the time. You turf to general surgery all the time. And so just turf it. I don't know what the answer is. Let me call X. Same thing here. I'm not sure what the answer is, but just go ahead and use that that platform that's on the site, and they'll answer your question for you. But seriously, do not get involved in voting related questions. You don't have time for that. I don't have time for that. That's why the platform exists. Turf to the platform. Tip number 4. So here's the thing. I hear a lot of the times, I don't want to bring this up because patients are going to ask me who I'm voting for. And I hear this same kind of animus when I talk about getting patients started on addiction treatment in the ER. physicians will tell me, I don't want to start patients on evidence-based treatment in the ER because I'm afraid that I might precipitate withdrawal, which is this like 1 in 400,000 complications. So it's a boogeyman. It's this really sort of trumped up, excuse to not do this, not do the right thing. Well, in this case, when it comes to voting, people are concerned. If you start the conversation, people are going to ask, who are you voting for? I'm here to tell you, number one, there are 2 very easy responses, but number 3, I haven't even been asked that yet. So I've been doing this for about 2 years. So if you are, here's one response. I'm voting for you and your health. If you want to be less cute, you can say, as your doctor, as your social worker, I can't advise you who to vote for, but regardless of who you support, I think it's vital that we all make our voices heard. So the action here for you is just have one back pocket script to answer that question. And then lastly, just remember, we've got your back. We have an entire scripts page that has lots and lots and lots of questions and common answers that we give. And so you don't have to think about this on your own. So in summary, number 1, plant the seed. Simply asking the question gets you 80% of the impact. As Maya said, the mere exposure effect is incredibly important here. And the fact that your healthcare provider is doing this, you're going to really, really take it to the next level for them. Number 2, identify where do you want to do this? Social history, after the biopsychosocial, at the end of the session, in your wrap up. Number 3, prep your scripts. And remember to push through the counterfeit yes. They're going to tell you, yes, I'm good, I'm fine, I'm registered to vote, I'm pretty sure. Because nobody really wants to say they're not registered to vote. But push through that and transition to, do you want to double check that you're registered to vote? And then lastly, you do not have to be an expert. Turf to the platform. And that's all I got for y'all. Thank you very, very much for listening. And if there are any questions, we can take them.